All right, so I've cut some blood vessels, and this heart is now free at last. So we're gonna go through the pieces of the parts here now that we can see it. Well, this is kind of interesting because now you can see the trachea going all the way into the lungs, and behind the trachea, here's the esophagus, and that's heading down to go through the diaphragm. You see that going through the diaphragm? Right, it's going to go through. There's that vein or nerve. Sorry, I cut the vagus nerve. You're never going to breathe again. This is the end of the aorta right there. Sorry, you're gone too. Dead. All right, so let's look at the heart. I'm going to take my pig out of the pan here. So that's not a good background to look at. Let's put it on a piece of paper towel. All right. Let me get oriented here. Things look different when it's outside the body. Okay. All right. So here's the pig as the heart as it was in the body. Right atria, right ventricle, left atria, left ventricle. So if we start with blood coming back to the heart, I'm going to flip it over to the dorsal aspect. Here's the inferior vena cava that cut that blood vessel. Superior vena cava that dumps into the right atria. From the right atria, it goes into the right ventricle. The right ventricle, big muscular thing. It pumps blood out. Here's the pulmonary artery. So this is a pulmonary artery. This is taking blood into the lungs. So I've removed the lungs and kind of butchered the pulmonary system. But that takes blood to the lungs. Then it comes back through pulmonary veins into the left atria, left ventricle, big honking side of it, that pumps, and that sends blood out through the aorta. So this is the aorta coming out here on this backside. This is the pulmonary artery, and behind that, dorsal to that, is the aorta. So you should be able to trace the flow of blood through the heart. Again, here's a coronary artery. That's actually connected. If we follow that, you'd see it's connected to the aorta. So it's carrying oxygenated blood to the ventricles. Pretty cool. Pretty cool. So there are valves in here. If we cut this open, I don't know what that's going to look like. We're going to cut it open. So I'm cutting into the muscle of the heart. You can see the muscular walls of the ventricles. These are parts of the valves. You've probably heard of people who've had valve replacements. So we have valves that connect the various chambers of the heart to keep blood from flowing one direction. That keep blood flowing in one direction. Sorry. This one's actually in pretty good shape. We have these little strings. You can see that maybe. That's called a chordae tendineae. It's like a parachute cord. Oops, sorry, just ruined that for you. Okay, so that's the heart.